I am so thrilled to welcome you to today's webinar, the first one of the new year for us, entitled The Impact of COVID-19 on Children and Families, which is a huge issue that I know we are all very concerned about, and many of us are living on a daily basis. So my name is Kandra Strauss-Riggs. I am the Education Director at the National Center for Disaster Medicine and Public Health at the Uniformed Services University of the Health Sciences. And I'm very excited to bring this webinar to you. Huge thank you to Norma Quintanilla, who is providing all kinds of support to this webinar. Please check out our other COVID-19 related webinars that are available on our website. I am very thrilled to welcome three amazing colleagues. Rachel Kaul is a clinical social worker who received her training at the University of Michigan. Ms. Kaul is the team lead for behavioral health in the Office for At-Risk Individuals, Behavioral Health and Human Services Coordination at the Department of Health and Human Services. Arrealia Gavins is Director of Early Learning Practice for Early Childhood Innovation Network with MedStar Georgetown University Hospital. Ms. Gavins has been serving families in the field of early care and education for 28 years. Joelle Simpson is a nationally recognized expert in pediatric disaster preparedness and pediatric emergency medicine. She is the Chief of Emergency Medicine at Children's National Hospital in Washington, D.C., and serves as the medical advisor to the Prince George's County Public School System here in Maryland. She also has an appointment at the George Washington University School of Medicine and Health Sciences. I'm glad to tell you that all of their slides and the recording of this webinar will be available afterwards. APHA has designated this webinar as an educational activity for one AMA PRA Category 1 credit. You do have to be registered. Well, you have to be registered to be here. So if you're on the registration list, you are eligible. And there's some detail there about nursing, medicine, and the health education CHES credit that's available. I and the speakers have no financial or commercial relationships to disclose related to this online educational activity. And just wanted to give a little brief overview of we at the National Center for Disaster Medicine and Public Health work on a variety of levels to provide materials in terms of education, research, and various academic activity for the nation in preparedness, response, and recovery from disasters. So I encourage you to check out our website and all of our other awesome materials that are there for you. Okay. I know lots of people are still entering here. It's very exciting. But for the moment, I would like to hand the microphone, so to speak, over to Rachel Kaul, who will start us off. Thank you, Rachel.
Thank you, Kandra. Appreciate it. All right. I'm going to start my slideshow here. Thank you so much for giving me the opportunity to be here. I know that we have a very broad and diverse audience. According to the registration, we have educators, we have parents, we have caregivers, we have providers, healthcare and behavioral health. So I'm going to try to make my comments relevant to a variety of you. My background, actually, I started my career doing pediatric brain injury and physical med rehab work. And really trying to help families deal with incredibly difficult adjustments to their circumstances. And I can say that COVID has brought back so much of those kinds of concerns for me, the kinds of conditions that families are needing to adapt to now, I think are really challenging. And I'm curious about you as the audience. I'm going to ask Norma to launch a poll just because I'm curious about the kinds of households you live in terms of what kind of age groups are in your household? And if you don't have children in your household, in terms of the work you do or what you're concerned about, what age group resonates sort of the most with kind of what you're concerned about when you're thinking about the impacts of COVID on families? And you can pick as many that apply. Now, while you're going through the poll, I'm just going to give you a brief overview. I'm going to be sort of setting the table for the rest of the talk, I'm going to try and just give an overview of what we know now in terms of impacts that we're seeing on children and families, how we know those are showing up, and then more importantly, some strategies, tips, and resources that can help us address those. We've really seen a lot of innovative and creative work on the part of folks who are concerned about kids. So I'm going to try and share some of those. Throughout my slides, there are links to the resources I'm talking about. So you will have a chance to download those or link to those when you get the slides. So rest assured, these links will be available to you. All right, let's go ahead and close the poll just to see where we are. Wow, it's a pretty even mix. People are, a lot of people, and go ahead and show the results. So you can see a lot of folks are living with or concerned about young adults, but that mix of children between really 0 to up to teens, that's a big mix. And what I'm interested in too is the older adult section. Many of us are living with older members of our families or have taken older members of our families in as caregivers, and that's creating a specific dynamic too that I'll touch on. Okay, thanks for that, Norma. You can stop sharing that. My next slide. There we go. Thank you. All right, so let's kind of take an overview of what the stressors are that people are experiencing right now, families and children. Obviously, the educational interruptions, and that's not just the home learning, the homeschooling that we're seeing, but also a lot of families are dealing with having to pivot very quickly between returning kids to school and then the schools return to home learning. And that I know has been incredibly disruptive for many, many folks. Many families in our area across the country are experiencing housing and financial instability, food insecurity as well. It's harder to access healthcare, behavioral healthcare, childcare, which means that caregivers and folks who are in those roles are under an enormous amount of stress to do all of those things as well as provide in jobs as well. There's been changes in family roles. Older kids are having to take more responsibility for younger kids. If older adults are living with family members, people are taking on more caregiving roles. And actually, I know a lot of parents who say, I never actually understood just how challenging being a teacher is. I knew their job was hard, but now I really, really understand that. I hear that quite a bit. And another thing I just want to focus on or point out is that we know that 1 in 5 Americans live in a multi-generational household. Now, this is from a Pew Center for Research study, and this was before COVID-19. So the other thing that we know is that more of these Americans are living in multi-generational households. And what that means is that young people are living in the same household with people that are at higher risk for adverse consequences to COVID, which means in those households, even the general public health kinds of practices that we would take to keep ourselves safe are even more important, and kids may feel increasingly kind of locked down in those households as there's more concern about more vulnerable family members. So the research on the impacts, the data is early still. We've only been in this for a year, even though I know that is a long time. But we have had several surveys that have gone out. CDC has done household pulse surveys. The Kaiser Family Foundation has been doing surveys. State and local health departments have been doing different kinds of data mining to find out what are the behavioral health impacts, particularly on children. And the first thing that we see is we know that up to 40% of adults are self-reporting that they're experiencing increased symptoms of depression and anxiety. Now, when you take a look at parents, almost a third of them are having concerns about their own mental health. And then they have concerns that they are seeing and actually observing changes in their children's emotional well-being. So this is a concern that we really want to get in front of. In addition, looking at emergency department surveys at the state level, in many, particularly urban areas, we're seeing increased admissions due to self-harming behavior, whether it's attempted suicide, overdose, or even just suicidal ideation. So we do expect that we're going to see evidence that there's been an increase in suicide as well, unless we continue to really take a focused look at getting ahead of this. Sort of within the household, when we're talking to parents and caregivers and families, you can see there's an array of symptoms that show up that tell us that families are stressed. What is interesting to me when I look across these symptoms is that when members of our household are experiencing these, it disrupts the entire family system. It actually impacts our ability to talk to one another and interact in a helpful way and to support one another. It's very hard to pay attention to the needs of others in the household when we ourselves are experiencing anxiety, sleep disruption, difficulty concentrating, irritability. These kinds of symptoms can really make it even more difficult to support the children and teens in our lives. One of the tools that I wanted to point out is the Adverse Child Event Screening tool. There's been a strong correlation between adverse health outcomes and adverse child events. So what we're also encouraging providers to do, and if you're a parent, you can encourage your own provider to do this, is to really screen for these adverse child events. And if you use the screening tool, it also links to some interventions that can help mitigate those adverse child events so that health impacts are not, can be prevented, is what we're hoping for. The other resource I really wanted to point out here is COVID Coach. I don't know if you've seen this before, but it's a smartphone app from the National Center for Post-Traumatic Stress Disorder. It has a variety of screening tools, of ways of monitoring and tracking mood, coping techniques, and sort of just to identify how you're doing on a day-to-day basis and really monitor your progress as you're trying to cope with the stress of the pandemic. So I really recommend you take a look at that if you haven't already. So how can we support children and teens? You know, one of the first things I wanted to suggest here is I really like to recommend starting the day with an intention with our kids, with our teens, sort of having a conversation in the morning, asking, what kind of day do we want to have today? With smaller children, maybe giving them some options, some words, some feelings that they can choose to help them sort of set a goal for the day. Do you want to have a busy day? Do you want to have a fun day? Do you want to have a helpful day? And same with teens. With teens, really ask, what is one thing that at the end of the day you'll want to have done or accomplished or been happy about? So have them participate in sort of creating an intention for the day. I think it's important to reflect back also. We know that regular routines are incredibly important, and that's been very difficult throughout the pandemic, given the school disruptions and the lockdowns, et cetera. So I would, and some of us also may be getting tired, right? That COVID fatigue. So I'd recommend you reflect sort of on a time maybe earlier in the pandemic when maybe you were able to create some structure, a system or routine, and then compare it to how you're doing now. And if you think you're doing better, that's great, keep that going. But if you think maybe you need to take a step back and put some of those systems back in place, recommend doing that. Definitely schedule time to be together on a regular basis, whether it's at meal times or maybe a weekly activity that your child or your teenager identifies that they want to do with you as a family. And also teach your kids coping skills and think about the different domains of coping. Behaviors that are calming, there's also distraction behaviors, physical coping skills, as well as processing, things like being able to express themselves through art or through journaling or through puzzles, those kinds of things. Take a look at your kids and say, what is the go-to coping mechanism that I know they can do? And then what domain could I maybe give them an additional tool or skill in? A colleague of mine had told me about a strategy that her younger siblings are using, which is creating a coping box, taking a shoebox and decorating it and filling it with things that bring them joy. For young kids, this can be a really powerful thing. They're own way of creating a plan to identify what brings me joy, what makes me happy, what keeps me calm, and putting it in a physical, tangible place. The National Center for Child Traumatic Stress, as the National Center for Child Traumatic Stress Network, has just a plethora of resources, and that link will take you to them, as well as resources for parents and educators on how to talk to kids about some of the difficult things that we're dealing with right now, including vaccination, and even some of the other situations we're managing in our society right now, the social inequity as well as civil unrest. And with teens, I think a lot of us understand that teens are at a very difficult developmental period where they need to be separating from their parents and their caregivers, and now they're being forced to sort of cohabitate all the time with them. I think engaging teens in developing their own coping strategy is really the key. Make a plan with them and identify what the concrete things they're willing to do are. Help them identify when they know they need to take a break and maybe access those coping mechanisms. And be aware of the Disaster Distress Helpline. This is a sort of a sister hotline to the Suicide Prevention Lifeline, but it's staffed 24/7 by trained crisis counselors. And the feature that teens really like and use is the text feature. Often they don't want to talk to an adult, maybe in their household or someone they know well. But if they understand that they can text, talk with us to that number, that they will be connected with a trained crisis counselor who can talk them through stresses they're having or give them advice or resources that might help them. I also think thinking in terms of building a family resilience plan is an excellent idea right now, and revisiting it if you've done it in the past to see how it's working for you. Some of these strategies I think can be extremely useful, and particularly identifying new things to do. Maybe not, again, every week, that bar may be a little high, but maybe once a month, really identifying something new that the entire family can engage in. Another strategy that a provider told me about the other day was in her house, they have a whiteboard in the living room with the family house rules. And you'd think those rules would be things like pick up your room or put the dishes in the sink, kind of tasks and chores. But actually the rules are more like, say I love you when you say goodbye. We help each other with things. We take turns. Things like that really promote kind of positive interaction behavior. And I thought that was a really nice thing to have right in the middle of the living room that you could refer to when behavior is maybe not following the family rules, or to encourage those positive behaviors for the family. Some additional resources I just want you to be aware of. Of course, the Substance Abuse and Mental Health Services Administration has not just resources, but also can help you identify and locate a provider if you do feel that you or a member of your family could use some support from a behavioral health professional. With kids being online so much, we're extremely concerned about cyber safety, and this resource from the WHO gives some tips on how we can continue to keep our kids safe online. I also recommend you talk to educators as well as other parents to see what they're doing to make sure that kids are safe from whether it's bullying from other kids or from outside people trying to make contact. And I'll let you take a look at these other resources, but one I didn't mention that I'm going to ask my silent co-presenter, Kayla, could you put in a resource for the Administration for Children and Families, Kayla, in the chat box? The Administration for Children and Families has, again, a great deal of guidance and excellent targeted resources for families and children. And I recommend you take a look at those as well. And with that, I think I'm going to take a step back and turn it over to my co-presenter, Arrealia, to talk a little bit about the work she's been doing.
So I would like to just kind of share a little bit today about parenting during the pandemic and some strategies that families can use to promote family wellness. And these are strategies that not just parents and families and children, but all of us can utilize throughout the pandemic to support us in our coping and increase our self-care throughout this time. So at the Early Childhood Innovation Network, we collected some data from teachers on some urgent needs that families were having. Some of the things that popped up were very similar to those things that Rachel shared: the technology, the mental health supports for children and family, as far as activities for children in the home. We also gathered some data from community families who had went back to work and were taking children back into the childcare space. And so some of the high priority needs that families identified were just their basic needs, supports around concrete resources, mental wellness supports of families, respite care, was something that families asked for, and they were needing some relief, as well as technology supports. We're going to dive a little bit into the self-care techniques today throughout this time. So what are ways that we can promote self-care with our children, our families, as well as ourselves? Some techniques that we can try is breathing techniques. Breathing techniques can be done throughout the day, opportunity to pause and reflect. One breathing technique that you can use is 4-7-8 breath. It's where you breathe in and a count to 4, you hold that breath to 7 and you breathe out. If that is a bit extraneous, you can also use 4-1-4, breathe in for a 4 count, hold the breath for 1 and breathe out. So breathing techniques are a way that we can promote our self-care throughout the day. Practicing mindfulness is another way that we can support our self-care. And mindfulness is simply just a way to be aware of our thoughts and our feelings and our sensations in a present moment. So having that time to pause and reflect and focus on ourselves is a great opportunity for us to begin to practice mindful techniques. Positive event journaling is something that we can do, and families can do, children can do, each of us can do. We can keep a positive events journal during this time throughout the pandemic. It's very easy to get caught up in negative events during this time throughout the day, but giving us a time to focus ourselves and refocus on the positive events. So just simply journaling or writing down 3 good things, no matter how simple they are, that happen throughout the day. This gives us an opportunity to use a new perspective throughout our day, as well as increase our moments of gratitude. And it improves our mental health and reduces our stress. Another way that we can promote self-care with children and families, as well as ourselves, is to set some limits, to think about what are we taking into our eyes and our ears throughout the day. This might mean that we might want to limit times that we use search engines or look at news throughout the day or social media, and really spend time surrounding ourselves with people and music and opportunities to create calming spaces with our family throughout the day. Additional opportunities for self-care that we can do throughout the day is to really spend time communing with nature, taking a break throughout the day just to go for a walk and to spend time with nature has been proven to have restorative effects on our body, as well as produce calming space. Lastly, I wanted to share a little bit about self-compassion, being kind with our own self-talk, having patience with ourselves, and forgiving ourselves at times when we fall short throughout the day. So it just gives us an opportunity to think about how, if our compassion doesn't include ourselves, it is really incomplete. So how do we have time to pause and reflect and be compassionate with ourselves throughout this? I wanted to share some additional resources from the Early Childhood Innovation Network. We've created a series of videos that families could use, both through the Early Childhood Innovation Network and the MedStar WISE. And so these are videos that you can use as parents, you can use in school settings, you can use them in various ways to help families to promote mental and social and emotional wellness, as well as family mental wellness throughout this pandemic time. So I'll just give you a brief sample of what that might look like. So this is just a sample of some of the videos. We have a series of 5 videos on families parenting during challenging times, as well as other videos of that families can do activities specific with their children. So I wanted to
Yes.
Okay, thank you.
Bray Bray conquers the coronavirus, follows a little boy named Bray Bray as he learns about the coronavirus and what he can do to help. At the end of the story, Bray Bray invites you to think about what you can do to help too. The book is written by Ashley Maxine Mormon and illustrated by Joanna Whiteley. It will be read by Kandra Swilly.
I just learned about the coronavirus. Maybe you learned about it too. Some people say that it reminds them of the flu. It makes you cough, gives you a fever, and makes it really hard to breathe. Some people have to go to the hospital to fight it and to get all the help they need. When I learned about it, I started feeling really down and blue until I learned there are many things to help that I can do. I can stay at home, wash my hands, and listen to what grown-ups tell me to do. I can even play fun games and FaceTime my TT too. I still really miss my teachers, my friends, and going to the park, but I know that if I stay at home, that I'll be doing my part. I'll be a hero, kind of like the doctors, nurses, and cashiers at the grocery store too. All of them working day and night to help keep us safe and with enough food. Sometimes I may feel nervous, mad, down, or blue, but I can cheer myself up by talking to my mom or dad about how I feel or finding something fun to do. I can play with my toys and of course do my schoolwork. I can even watch TV or make some cool artwork.
I'll just pause it there. But I wanted to just kind of share a variety of those resources. And so you'll get links to these resources we have available through the Early Childhood Innovation Network. Parenting during challenging times, a COVID families video series, connecting to families, as well as some resources from WISE, which includes a variety of teacher wellness, family wellness workbooks, coronavirus response page, and other resources. So I'm going to stop share and turn it over to Joelle.
Hi, thank you so much. I am going to sort of follow up mostly in speaking a little bit more on the systems level in terms of how we care for our system. We've heard really nicely about how as a family unit, we can care for each other and our kids. And I think it's been really important to see the growth of relationships we've had both between school systems, childcare systems, and families, and also the healthcare system as we move through this pandemic. So in walking us through the evolution of the pandemic from last February to March until now, the progression of our impact on families has been seen mostly in the initial closure of school and childcare facilities, limited access to primary care providers, as well as healthcare in general, no or limited access to testing for children or even families in many states, and an overall reduced access to social services. In addition, as my colleagues have talked about today, the impact, and especially the mental health impact of the unknown earlier on in the pandemic, posed great stressors to our families and to our system. I know from the healthcare side, and I work as a pediatric emergency medicine physician at a large children's hospital here in Washington, DC. We were unsure of how to communicate earlier on with very little evidence about the impact of COVID-19 on children and families. And that in itself instigated a lot of fear and concerns that have continued as we have further unknowns throughout the progression of the pandemic. Once we had sort of the first few months under our belt, we soon entered a world of telemedicine and even virtual school. So within the healthcare system, we were trying to figure out how to continue preventive care, how to mitigate the disparities we knew that were looming in healthcare and access, and how also to talk about the fatigue that was setting in terms of the isolation and the new reality that we were all living in. From our vantage point at the Children's Hospital at this point, we worked very closely with our school partners to learn collaboratively on implementing tele-technologies and being able to increase access to all our families, regardless of ability to pay. We had a lot of distributive partners with our information technology partners to distribute things like iPads and computers, and collaborating with our school systems and with our social service supports in the community in order to meet the needs of our families. We progressed to having a lot more highlights about the mental health impact on our communities and our families. At this point, working through the challenges largely of significant job loss, the financial crisis, the race tensions, and continuing to find greater and greater numbers of adults in particular with chronic health conditions and increased mortality across the country that was evident in the news and certainly no secret to our children. The increase in mental health surge during the pandemic has certainly, from our vantage point in the hospital, and specifically from the emergency department, saw that we had significant gaps in emergency services for mental health for our children and our families, and certainly needed to collaborate with our providers in the community to strengthen the safety net that we have to meet those needs and hopefully to mitigate the ongoing surge. We also saw that there might have been altered social supports for our families in terms of having our extended family network was often limited in being able to access the family unit in order to support parents who were caring for kids. So grandparents, aunts, uncles, the distance between family members was certainly seen. And in the hospital, as many of us have had to limit adult caregivers coming in with children, we saw that dynamic playing out and certainly had to work with some just-in-time solutions in order to better communicate the stresses of the ongoing issues around the pandemic. And then lastly, one of the other things I want to talk about is the disparities. We saw that the exacerbation in chronic illness, the social determinants of health factors that were playing into putting significant disparities in certain populations that were succumbing to COVID-19 was playing out in the media in terms of news headlines. And we were continuing to see that also in our school system and childcare system in terms of having reduced social services supports and screening services that are often available in the school system, not as accessible to our families. And then now we're also currently dealing with the vaccine rollout and the degree of public trust that we hold in terms of educating and communicating the safety and the preventive health measures around rolling out the vaccine. So I highlight the progression of this pandemic from a system perspective, starting with decreased access, the onslaught of telemedicine and virtual school, the impact of our mental health crisis, and then other disparities around chronic illness and even race and ethnic disparities, to talk about what are some of the seem to work, at least from our example here in our healthcare system and the school system that I've worked with, which has been Prince George's County here in Maryland. First, what we have seen time and time again is the impact of continued communication and collaboration in in both of our systems. So education and healthcare, I think, in one of the the greatest wins that we've had during this pandemic is how closely we've had to collaborate to keep our children safe and to keep our families educated on what to do for the kids in terms of access to education and in terms of preventive measures during the pandemic. Secondly, as we come up with new systems, whether that be ways to screen, ways to provide testing, ways to provide social services to our children, we review and constantly revise protocols and policies in collaboration with our families and with our other partners in the community. And lastly, we've learned more and more, time and time again during this pandemic, that the messenger matters. As we continue to work with our vaccine rollout currently in our local Prince George's system, we have learned that the importance of heralding leaders in our community that have some degree of the public trust, whether that be the leaders in our public health system, in our healthcare system, in our education system, to speak to our families, particularly those who have succumbed to the concerns around the pandemic, dealing with chronic illness, dealing with children with special healthcare needs, and all of those vulnerabilities. We've learned time and time again that the messenger matters. As a system, it is incumbent upon us to do what is best for our families and our community to address those concerns strategically. And I think we've done an excellent job here in the DC and Maryland communities, but we certainly have a long way to go as we continue to work with the vaccine, continue to work with access to testing, and as well as screening for the multiple comorbidities we've seen due to this pandemic, whether it be the mental health crisis or other chronic disease progression that we've seen in our children. Thank you, Kandra.
Wow, this is so awesome. Rachel, Arrealia, and Joelle, thank you so much. I really appreciated the different and linked perspectives you each brought to this topic. And I'm super impressed that you all stayed on time, and we have 20 minutes for questions. Thanks, Norma. And we just encourage you to submit your questions in the chat box, please. I am super thrilled that we have had over 320 people on this webinar. And so I'm sure there are questions out there that you'd like to pose to our speakers. As I await questions, I actually have a question for you all. And any of the three of you can answer this. So to Joelle's point about the vaccine rollout, right? So our kids obviously are hearing about this, and some of their grandparents are getting vaccinated, not others, some of their teachers, whatever. It's sort of a little bit all over the place, but it certainly heralds yet another shift in how children and families are going to be living, right? And so I guess my question is, how would you recommend we talk to kids about this upcoming shift, given that there's a lot of unknowns still?
Well, I'll start just by saying something that occurred to me after I finished was, I think we've got a lot of reason to be reassuring and hopeful with our kids, but I think that really needs to be balanced with managing expectations and being honest about the fact that things are not going to change as quickly as they'd like them to, most likely, that it's progress. And this topic came up on a presentation I did with colleagues of mine from USIS, Brian Flynn and Josh Morgenstein, about being able to be optimistic and hopeful and positive, but still managing expectations. I think that's important. I do know that the National Center for Child Traumatic Stress has some guidance on how to talk to kids about this, as does the CDC.
Agree. I was going to piggyback on that. You know, I feel I sit here for sort of the systems level as well. And we've made a very concerted effort due to feedback from our education system and the sort of numbers they've been seeing in the disparities of who has accessed their virtual education learning platforms, and actually had some panels at our hospital system where we invited especially teenagers to speak to what was the reality they were experiencing during this pandemic. And it speaks to one of my points about, you know, I have learned even personally from the education system about really how to address, how to speak, how to educate the different levels of, or the different age groups of children in addressing the reality of this pandemic. It's no secret anymore. So I agree with Rachel in being very front. But once again, I can't tell you how much I've learned also that the messenger matters. Whether it is coming from the trusted source of their parents, or whether there is, you know, I have a niece who loves to ask me all the science questions, or even, you know, reaching out to that primary care provider, even if it's in a virtual format, in order to provide that information to your children.
Terrific, thank you. Okay, we have all kinds of questions rolling in. The first one here is, can anyone recommend resources and support for relatives or grandparents who are currently serving as parents? Arrealia, some of your materials speak to this, I'm not sure.
So some of the resources that we have, and I will just go ahead and click them in the chat box. The link of resources can be utilized with families, parents, relatives. A lot of the tools, when you go to the ECIN video web page, you will see printouts that you can do, activities that grandparents can do with their children. So really thinking about a variety of resources, and a variety of resources that speak to different cultures. And so understanding that, you know, diverse families are included in the resources. So seeing images and pictures and children and families that look like all of us is a high priority to include grandparents.
Awesome, thank you. Joelle, we have a couple clinical questions, not to give clinical advice on a webinar, but someone wants to know, what are the recommendations for children receiving the COVID vaccine?
Well, currently, as you know, many of the vaccine manufacturers are starting the studies for children. So I think it'll be really important to learn from those studies. Certainly the impetus of what we've learned so far from the adult studies is that the vaccine seems to be very effective in mitigating the COVID pandemic, the COVID sort of symptoms and complications of it. If the same is found for children, I think it would be likely well advised, but we won't know until we have the results from the studies being done on children.
Okay, yeah. And we have someone asking how long you recommend that people wait to get the COVID vaccine after receiving another vaccine.
How long people wait to get the COVID vaccine after other vaccines?
I think that's the question.
I mean, if you've received another set of vaccines, I do believe that there might be criteria about when you get another, especially if you have any reaction to the prior vaccine. But that would be something to discuss with your primary care provider.
Yeah, thank you.
And also, I was going to say, although I know it's sorry, Kandra, I know it's can be cumbersome, but the CDC actually does have really specific guidance on that on their website. So you can go to their page and search for vaccine recommendation.
Yeah, thank you for that reminder. Absolutely. So we have one person who is asking if we've seen a delay in child development, speech development because of adults wearing masks. Is that a concern, especially in early childhood?
From my understanding, the jury is still out on that. I think this is another area where I found the collaboration with the school systems quite helpful. In my last conversation as the medical advisor for the Prince George's County school system, my understanding is, fortunately, there are actually some kids that are thriving in a virtual environment. And it might be some of those children that might have social anxiety in a larger crowd and seem to be able to adapt a lot better to the one-to-one virtual experience. And so to that end, I think being able to see one-to-one on a computer screen with your teacher, if you have access to those resources, that might potentially, one can assume, enhance their sort of development. But I am not aware of sort of large-scale studies to say that we've seen significant delays, but don't hold me to that. I certainly can, we can follow up afterwards with a more thorough analysis of that.
Thank you. A few questions about vaccine here, sort of the unknowns about the vaccine creating anxiety and tension, and then, you know, sort of rumors, and maybe some ideas for addressing those.
I'd say one thing is, which Arrealia brought up, really managing media consumption and social media as well is important because of the information is changing, and as we know more and more, that can make it seem in conflict, and there's disinformation out there as well. So I think, and back to Dr. Simpson's point of the trusted messenger on this, it's very important to pay attention to the messenger that is most trusted for your community and for your stakeholders.
Yeah, and I would add also in collaboration, once again, the partners in our system, as I feel like I'm saying on this webinar, this is what we know today. We acknowledge that there's a lot of uncertainty. I think even just acknowledging as a healthcare provider to our education leaders and to our families that this is the information we have now and it's going to evolve, expect that it would evolve, is that in itself to me suppresses a fair amount of anxiety, in that I'm not being elusive to the fact that I know more than I do. And so I found that to be quite helpful in mitigating some of the anxiety. The other descriptor that I tend to use, I've seen in a lot of analogies in other health systems, has been this concept of a Swiss cheese model, where we align a lot of different preventive measures to the COVID-19 pandemic, right? So we're washing hands, we're distancing, we're avoiding large groups. We are adding the vaccine as another slice of cheese. It is not the foolproof cure to COVID-19, but it is another slice of cheese to mitigate the impact of the pandemic on your family. And so when you explain in that context, I think setting the expectations, and like I said before, continuing to review and revise the message with that trusted messenger, for me, so far, that has been a win-win for our system and getting everyone on board.
Absolutely. We have concerns about getting resources to high poverty areas, rural areas that may not have good internet service. You know, obviously in this era, we're relying so much on online services and resources. So maybe what are some community-based organizations that can help with that? I think also, well, I don't know for sure, but there have been headlines lately about big tech perhaps playing a role.
Yeah, I think I spoke a little bit about that. Also, another thing that we learned as we were working with the school system, and they, you know, shared with us information about families that were having a challenging time with IT support and so forth. And, you know, I think this is where a lot of creativity has come in, and it's very different for different communities, whether you tap into the philanthropic world, tap into big tech, tap into other government resources that may be out there that we weren't aware of. Because from a healthcare lens, we may not ever have had to explore those before. But we both systems, education and health, have a vested interest in improving virtual access for our families. And so I think that partnership has been really helpful in our community to think creatively about doing so.
Yeah, absolutely. Someone had a question about the texting platform. Is it specific for teens, or can young or older adults use this too?
No, the texting for the disaster distress helpline, the texting platform is for anybody. I bring it up for teens because, quite frankly, that's almost the main way they connect with the disaster distress helpline. They really like it, but anybody can text, and if that's a preferred way to communicate, definitely.
Okay, yeah. Someone's asking, can you comment on the shortage of pediatric mental health providers to care for children with serious mental health problems during COVID? Yeah, we know this is an ongoing challenge.
So I agree. That's one of our largest challenges, particularly as a large children's health system here. Again, in the feedback from our primary care providers, mental health providers, school system, we realize that we have to increase that safety net across all levels, whether it's on the preventive end, the community supports, and then as I sit in the emergency department, sort of the crisis intervention. Luckily, we're having a lot of conversations right now. I think the model is very different in different communities in terms of access to resources, but certainly I welcome we've had a lot of creative exploration of how can we pivot as a healthcare system to really provide the support for those needs. I don't have perfect answers, but I know that they are being explored. I don't know if any of the colleagues on the call have examples that they've seen that have been new and emerged over this past few months during the pandemic.
Yeah, and I'm excited to see various people putting resources in the chat. So keep that up. Let's see. Okay, someone's asking, can you speak to the need, and I think this is probably a Rachel question, of addressing collective COVID trauma before delving into particular circumstances of adverse childhood experiences?
I think what we've seen, recommendations that have come from researchers as well as the American Medical Association, subject matter experts as well, really talk about needing to start with sort of a public health approach to addressing grief, loss, and trauma in our communities, also even historical trauma. So kind of taking a page out of our public health approach to educating, cross-educating providers that may not be as familiar with these kinds of issues and concerns, I think is a really important focus. At the federal level, I know that we are engaged in several initiatives at the CDC, in particular around sort of looking at community wellness, taking those considerations, particularly social and economic disparity, as a central part of that. So I hope that gets close to the answer of your question.
Thank you. All right. Someone is asking, could the panelists explore or share their perspectives if employing certain fundamental change management theories to assist children and families to cope with the buildup of stress until the pandemic subsides? I think the question is about change management theories.
I guess I'd say I don't know. I don't know exactly. I hadn't thought about it in that way. I think it's an interesting approach and something I'm certainly going to look into.
Mm-hmm. Yeah, I mean, I was also trying to think sort of constructively in a change management theory framework. I think more than ever, what resonates for me is that it takes a village, and this village has had to become really, really close in this short amount of time, fairly quickly. You know, I had never served as a medical advisor to a school system before. School systems and providing services for school systems had not been an area of business from an emergency department standpoint. I know that we have school-based health services that are robust and out there, and certainly also trying to meet the demands of the crisis during the pandemic. And so I do think that the collaboration of all of us to be creative with the needs of our community, with the best sort of, I guess, change management approach is just really unique when you're in an urban environment versus a rural environment versus also dealing with wildfires or also dealing with, you know, a surge in poor outcomes in your adult population. I think it's slightly different approaches in each community. So it's a difficult question to answer, but a good one.
Yeah, thank you. And what might be our final question is, you know, teachers in one person's area are looking at returning to schools in the next 2 weeks where they have not been since March. and there's a lot of anxiety. And so they're asking for support for the teachers in their area.
Thinking about a variety of ways that you can support teacher wellness. When we did our studies, what we noticed was a lot of the concerns that the families had, the educators also shared those concerns, especially educators of young children and public school teachers. And so just really thinking about some of the strategies that we would utilize to support families during this time, we would also utilize to support our educators. So many childcare workers and early learning educators are struggling with food security during this time. Thinking about how we roll out our vaccinations and prioritizing educators in multiple settings. So whether an educator is in a K-12 space or if an educator is in a early learning space, just really providing opportunities for the frontline workers and educators to be able to come back and feel safer and support the organizational culture. I would recommend that schools really lean into thinking about their organizational climate so that they can provide a safe space for children, families, and staff.
Awesome. Thank you, Arrealia. And we have a specific question. Are the ECIN resources available in Spanish?
I will need to go back and check to see that there are some links up, but I'm not quite sure if all of the links have been translated.
Okay. And someone posted the National Language Service Corps resource as a place to go for other languages as well. Wow, this has been so awesome and so wonderful to just connect with all of you out there in the world who are very concerned about children and families. It's actually incredibly inspiring to connect with you all and to see all the resources coming fast and furiously in the chat. We at the National Center for Disaster Medicine and Public Health are really honored to have brought you this webinar, and we just put up our website and social media connections if you want to stay connected to us. And a huge thank you to Rachel, Kaul, Arrealia, Gavins, and Joelle Simpson for taking time out of your incredibly busy schedules to be with us today and provide these resources to friends and colleagues across the nation. It's really incredible. And I know, as it all continues to evolve, I'm sure we will all be talking again. And I know I see lots of long-term colleagues have participated here. And I know, as a lot of you alluded to, our community has grown ever closer through this challenging time. So thank you all. A reminder, the recording and the slides will be available. So thank you very much. It's lovely to see your thanks in the chat, everybody. And I'm thinking of all of you as you go back to your various settings where you're working hard for our children and families.